Hi, welcome back. We're continuing with our plastic surgery information about different procedures. We've done breast augmentation in women and breast lift. Today we're going to concentrate on breast reduction for men. The most important thing is obviously men who come in with slightly enlarged breasts that they feel embarrassed about, especially when they're on the beach or other places, social occasions, is the size of the breasts. The first thing that needs to be determined is to make sure that there isn't any type of malignancy, family history, etc. Once that has been determined and proper tests, if necessary, have been obtained, then the decision for reduction can be made. In most men, the amount of breast tissue that is there can be easily handled with some incisions and surgery that does not involve a lot of scarring. This is just an example of someone with enlarged breasts, as you can see, and the way we perform surgery is through little incisions underneath the nipple. That allows us to remove some of the breast tissue, actual breast tissue that exists under the nipple or uterine complex, which usually projects quite a bit. And then underneath we can go in and remove a little bit of skin if necessary, and also perform liposuction. Liposuction is performed in several small incisions that are not even this big, and we go through medial, lateral, and one up here, and remove a lot of the fat that exists around the breast and in the breast itself, because the breast is made up of breast tissue, just like in a female, but there's also a lot of fat as well. So the fat is what we can suction out through these little incisions. As I mentioned, they are medial and lateral, and up here, and eventually over the course of 2 or 3 months are essentially invisible. So that is the most common way to proceed, and about 80% to 90% of men just require that type of a procedure. Post-operatively, they wear a compression garment for 2 to 3 weeks as to help minimize swelling and to help contract the skin. In men who have a lot of droopiness, then you really need to also remove skin to a much larger degree. And then removal of the skin involves an incision that goes all the way around the inferior portion of the breast, the inframammary fold. Sometimes it can extend out further, and some of the breast is removed, and then the skin above is placed back down here. The nipple itself, in some occasions, is actually grafted back into position. The final result, obviously, is a well-reduced breast with the amount of breast tissue that normally one should have. In boys, their chest is flat. As we get older and men mature, you don't have a flat breast. A flat breast looks funny on a male. There is some breast tissue, there is a little bit of definition that should remain, but as I said, the incisions usually just exist underneath the breast, the nipple uterine complex itself, and small incisions here. 9 out of 10 times the removal of skin is not necessary. When it is, we try and limit it as much as possible, but sometimes it does have to go on a little bit further. And in that way, over the course of 2 to 3 weeks, someone is back down to a size that they feel comfortable with. Here are some before and afters of this particular procedure.